Hello, my name is Dr. Jeff Aberle, and I'm going to take a little bit of time here to explain the concept of cervicogenic headaches. Now, most of you, if you have headaches, you've probably noticed the correlation between your neck pain and your forehead or eye pain or temple pain or wherever it is along your face, right? Sometimes people call it their sinuses. You've noticed that there is a spot in your neck that when you press either increases your headache pain or actually gives you some relief. So you've noticed a correlation. Maybe the spot is here, maybe it's in your shoulders or anywhere along your neck. In that if somebody, a massage therapist or somebody else comes along, a chiropractor, and pushes on those muscles, that then you notice the referral pain to the head. Well, how does that happen? So I'm going to use these animations here. I've got a whole bunch of different things here to show, impulses here and brain activation. And these little red circles here, I can move around and make larger, smaller, whatever I need to do. But it's just a concept to show you what's going on, how this happens. Because you just don't hear about this yet. I've been in practice since 1997, and I can honestly say that probably 90-95% of the headaches that walk into my office, I mean, maybe even more than that, are due to the cervicogenic nature. And cervical means neck, and genic means produced. So it's a headache that's produced from a neck problem. And the headaches are usually in the forehead. Now, what about the headaches that come from the base of the neck here and shoot up along the back and come up to the eyes? Well, part of that is from the nerve irritation that comes up right along this area, from pinched nerves or irritated nerves back here. But the facial component of it, the forehead, the temples, the eyes, the sinuses, a little bit into the nose sometimes, into these sinuses down here, that is cervicogenic. And then a migraine is just a more intense version of that. Now, I can go in and I can usually find these spots on people within 10-20 seconds. They're not hard. I know what to feel for, where to push, and I can find the tender areas and then recreate the headache. Now, you say, why would you want to do that? Well, it lets the person know that their neck is causing the problem, and that if you can fix the neck problem, you can probably fix their headaches, right? And that's a huge blessing to people. I mean, if you can actually fix that stuff, that would be pretty cool to them. But you have to be able to loosen up these muscles in order to do that. Now, I use lasers to do that, to loosen up the muscles here. It's a chemical reason for why the muscles are tight in the first place. And I'm not going to get into that here. I'll just leave that for another video. But the cervicogenic nature of this I want to talk about. So let's say that you get hit in the head with a softball. First of all, let me just reset this here. Okay, so let me just reset the position and get those things out of there, those red things. And we're just going to start with somebody that's nice and healthy, no muscle tension, no whatever. So if they get hit in the head with a softball, you would think that since the forehead is right next to the brain, that there would be a nerve that goes from the forehead right to the brain to tell the brain, ouch. But that's not the way it works. All the sensor information here actually traverses down into the brainstem and then comes up to the brain to be perceived as pain. So as the softball hits here, I'm not showing any pain. I'm just showing these irritation receptors, which are technically called nociceptors, as being activated. They will send their signal through the neuron up to the brain. And once the brain is activated by that neuron, finishing off up there, then the brain perceives that there is pain in the forehead. So there's a very important part to this, and we'll just run this for a second, that this has to be activated for you to notice pain here. And that's a big deal. So if this doesn't get activated, you would not feel pain here. If this nerve was cut, for example, you wouldn't feel pain here because the signal's not getting to your brain, right? Seems pretty obvious, but it's an important distinction here. So this is called a nociceptor activation here, and it's sending a signal up to this part of the brain, which is reserved for this part of the forehead. Now, the part for the back of the eyes might be right next to it, might be imperceptible from here with this animation that I'm doing, but you get the point, is that this part has to be triggered for you to feel pain. That's why I did it this way, so that the ball hits. There's no pain there yet until the signals get up to the brain. Then you feel the pain, right? Now, that might be, you're going to feel that immediately because these neurons are going so fast. But anyway, that's an important distinction. So, is there another way to activate this without getting hit in the head with a softball? That's a cervicogenic headache. And so let's just go real quickly to the neck here. So if we have irritation down here in the neck, when that nociceptor gets fired, it sends its signal up through the brain again, through a different neuron, and then it activates up there. And when this gets activated, then you feel the pain down here. Okay, now most of you, you're way past this stage and you're just constantly hurting. And so this is always being fired, or fired half the day or the end of the day or in the morning when you wake up, whenever you feel your neck pain, okay? So that means that's being fired. But it can start with just irritation receptors down here. And then you get the pain. And so it's hard to distinguish, right? But it's an important concept, because when I go to crosstalk, here is where you can have pain in both areas, but only being triggered from one. So I'll just play this here. And you'll see that this never gets activated. It's this irritation down here that sends its signal up, and it crosstalks with this neuron and triggers that one as well, without there being a stimulus or a hit here. So you don't have to, you can have a headache without getting hit in the head with a softball. Is getting hit in the head with a softball going to give you a headache? Yeah, obviously. But most people's headaches are not from that. Most of you probably don't even play softball. But this is the concept of crosstalk. Now, crosstalk comes from when I was younger. We had the telephones that connected to the wall through a couple of wires. Right? It was 2 wires. That's all you needed for your telephone to connect to the telephone company, and that did everything. But your 2 wires were going out along in cables that were right next to other people's houses' 2-wire telephone system. And once in a while, you could hear other people's conversations because the wires were so close to one another. That is called crosstalk. So here in this example, this nerve is close enough to this nerve, or there's a lack of insulation, or whatever the deal is, it crosstalks and triggers the other nerve, giving you 2 sources of pain with only 1 stimulus area. Isn't that amazing? Now, other people never get headaches because these either are far enough apart, or they have more insulation, or whatever the reason. But some people never, ever get headaches. Now, again, you could take this pain here, and I just showed it in the forehead, but your nerve could be here, right? Or maybe you get headaches from here all the way down into the eyes, or the pain shoots up around the head and comes into the forehead up to the eyes. That can be for fascial reasons as well. There's kind of some other reasons that could cause this, but this is the majority of the cervicogenic headache concepts. So temple pain, forehead pain, eye pain, sinus pain, all those are the typical headaches. And then the migraines are just more extreme versions of this. They can give you all kinds of weird symptoms visually and everything, but you can still find a spot in their neck that triggers their pain. And that is what's just so valuable for people to feel. Now, you probably already realized the connection, but you never really knew how, or maybe never even thought about how does this cause this. Again, I'm a chiropractor. I go about treating this stuff often to lasering because I like what it does with the muscles. So I use a nice high power laser to reestablish normal metabolism in the muscles. And I know that sounds weird when you're talking about muscles, but I got other videos that go into that in more detail. I don't want to get that in here, it gets too long. But I hope this was helpful for you. My name is Dr. Jeff Aberle from Aberle Chiropractic, and have a good day.